While I was here with the students doing research, I come across a young man, a Tibetan monk, who had come in and had been released from the Chinese prison, and they had tortured him terribly. And when I met him, he was really suffering. He'd only been here 6 months, and you know the symptoms of trauma. You know, he wouldn't look at you. You know, he was really withdrawn. He was very hypervigilant. And I felt very sorry for this young man. I sponsored him. And I talked to Geisha about him. You know, is he going to be better? Because I was so worried in my heart for his mental health. And Geisha says, oh, you just wait. We'll work with him. He'll be okay. And so I came back again another season and yet another season. And after 2 years, I had emailed him and said, when I come this time, I'll bring you a present. And when I came into the office of Geshe-la, suddenly here comes this monk, and he's smiling, and he grabs my hand, and he says, where's my DVD player? So I talked with Geshe-la at IBD about the possibility of putting together a program for people who do not have peace of mind, who are suffering from trauma in the United States. We put together a 6-week program. And within that program, each 2 weeks we did a different type of meditation technique. Last year, the state of Ohio gave us funding, $200,000, and our population was a group of women who had been physically abused and were also engaged in substance abuse with drugs and alcohol, which they were treating their own, we call it PTSD. And what we found was the outcome was that the afflictive motions of sadness and pain actually decreased, and the positive emotions increased of happiness, joy, compassion. But there was only one afflictive emotion which didn't become better, and that was anger. And so when I spoke with Geshe-la about that, he said, okay, we'll change our program a little bit because there's actually a technique that we can use for anger as well.
Some scientist, some professor from America, they told me, they already used to carry some program as an experiment, selected or volunteered people. A few weeks or was a program, and each day some meditation, mindfulness as well as compassion. Before that program starts, they test blood pressure and stress, all these things. And after a few weeks training, then they again test. So they found change, betterment, some improvement. So that's wonderful, wonderful. Now maybe times come. Now those individual or also the institution who already engage with such things, then some conference or some discussion. Then take a different experience and
stagnations,
limitations, discuss. Then eventually some kind of
yes. If they can come up with something concrete document describing everything,
then we can share with other people. Now, so as a result of some experience or actual experiment and research, now concrete result there. So then, now sort of concrete sort of plan or something, maybe I think useful. But some individual is already carrying this kind of program somewhere, but not unified so far. Maybe useful. So if they have certain sort of program, with a certain experience there, might be very useful. And there must be something we can learn from Pali tradition. And definitely certain things can be, add from Sanskrit tradition.